Humidity therapy is adding water vapor and/or heat to inspired gas. Relative humidity, or RH, is the amount of moisture in the air compared to how much is possible. Absolute humidity is the actual amount of moisture in air measured by grams per cubic meter or pounds. Convection is heat transfer through mixing of fluid molecules at different temps through a thermal current. Evaporation is the process of liquid to gas without boiling. Three main objectives of the nose are to heat, humidify and filter. Heat and humidify the process of the nose. When you inhale, air is warmed and moistened from mucosal lining. Then during exhale, air heats the tracheal and nasal mucosa, leaving behind residual moisture. Nasal mucosa is the tissue that lines the nasal cavity. Nasal mucosal lining is kept moist by secretions from mucous glands, goblet cells, transudation of fluid through cell walls, and condensation of exhaled humidity. Nasal mucosa actively regulates temperature changes and serves to promote effective heat transfer. The mouth is less effective because the ratio of surface area to gas is lower and there is less squamous epithelium lining in the oropharynx and the hypopharynx. Effects of breathing through the mouth on the pharynx is 3 degrees Celsius less and 20% less relative humidity. The isothermic saturation boundary, or ISB, is the point where gas becomes saturated to 100% relative humidity at body temperature. The ISB is located approximately 5 centimeters below the carina. BTPS stands for body temperature of 37 degrees Celsius. The barometric pressure and saturation with water vapor, which is 100% at 37 degrees Celsius. BTPS is achieved at the ISB. Air that is flowing out of the body has a decreasing BTPS as it passes the ISB. Air that is flowing into the body retains a constant BTPS after it passes the ISB. 4 reasons why the ISB will shift distally are: breathing through the mouth, breathing cold dry air, bypass of the upper airway. One example being a tracheostomy tube, or a high minute volume. Shifts in the ISB would suggest the use of humidity therapy. Humidification goal is to maintain normal physiologic conditions in the lower airway. Possible reasons for humidification are: humidify dry medical gases at a flow of more than 4 lpm, or if the upper airway is bypassed. Effects of prolonged lack of humidity are damage to the epithelium. Humidifiers add water molecules to gas. 6 lack of humidity signs are dry, non-productive cough, more airway resistance, more infections, harder breathing, complaint of substernal pain and dryness, and thick dehydrated secretions. 4 humidifier variables are temperature. Higher temp means more possible humidity. Surface area. More surface area means more evaporation. Time of contact. More time gas spends over water, the more water can evaporate. Thermal mass. More water and humidifier equals more thermal mass. Relative humidity percentages of humidifiers. The bubble humidifier has a RH of 40 to 50%. The HME has a RH of 70 to 98%. The Cascade, the Wick and the large volume nebulizer have a RH of 100%. 2 types of humidifiers are active and passive. 4 active humidifiers are bubble, passover, nebulizer of bland aerosol, and vaporizers. In bubble humidifiers, gas goes underwater then turns to bubbles. Use of foam or mesh equals more bubbles equals more surface area equals more humidity. It has pop-off valve so it doesn't explode. High flows could cause aerosol which risks infection. Pass-over humidifiers. Direct gas over the water surface. Pass-over humidifier advantages are: they maintain saturation at high flows. They add little or no flow resistance to spontaneous breathing circuits. They don't make aerosol. And they have a low risk of infection. 3 types of passover humidifiers are: simple reservoir, wick type, and the membrane type. Simple reservoirs. Direct gas over water surface. They are commonly used with heated fluid and invasive ventilation. And they are sometimes used with room temp and non-invasive ventilation, 2 examples being CPAPs or BiPAPs. Wick types have absorbent material which increases surface area. And they have a heating element that may be around or below the wick. Membrane types separate water from gas with a hydrophobic membrane. The water vapor can go through but not liquid water, which may hold pathogens. Large volume jet nebulizers are a device commonly used for bland aerosol therapy. They are pneumatically powered and connected to flowmeter. An unheated large volume nebulizer can produce 26 to 35 mg per liter of H2O. A heated large volume nebulizer can produce 35 to 55 mg per liter of H2O. A variable air entrainment port allows increased flow and altered FiO2. The mechanics of a large volume jet nebulizer. Gas goes in through the top and out of the jet orifice, then pressure builds over the water and decreases near the jet, which causes water to be pushed up the tube, which is then shattered into particles by the gas coming in. The particles that are small enough leave the nebulizer in the gas stream. Ultrasonic nebulizers are electrically powered and use piezoelectric crystal to generate aerosol. The transducer converts radio waves into high-frequency vibrations. The particle size is inversely proportional to frequency. And flow and amplitude determine the density in mg per liter and water output in milliliters per minute. Bland aerosol is liquid particles suspended in gas. 2 main liquids used are sterile water and sterile saline. 3 types of sterile saline are: hypotonic is used to dilute drugs. It is 0.45% sodium chloride. Hypertonic is used mainly for sputum induction. Isotonic is 0.9% sodium chloride. Reasons for bland aerosol use may be because patient has an upper airway or subglottic or post-extubation edema, or during post-op management or bypassed upper airway, or they need sputum or to move secretions. Reasons bland aerosol may not be used are: patient has bronchoconstriction, or a history of airway hyperresponsiveness. Vaporizer humidifiers heat water to gas, and are commonly used as room humidifiers. Passive humidifiers include heat and moisture exchangers, or HME, also known as the artificial nose. This device captures exhaled heat and moisture, then returns during inhale. It adds 30 to 90 milliliters of dead space. 3 types of HMEs are simple condenser humidifier, hygroscopic condenser humidifier, hydrophobic condenser humidifier. Simple condenser humidifiers use an element with high thermal conductivity such as metal gauze or parallel metal tubes. Hygroscopic condenser humidifiers use elements with low thermal conductivity such as paper and wool. Hydrophobic condenser humidifiers use elements that repel water with a large surface area. Do not use HME if patient has thick, copious or bloody secretions. Expired tidal volume of less than 70% of delivered tidal volume. Body temp of less than 32 degrees Celsius. High spontaneous minute volume. Or is receiving non-invasive ventilation with large mask leaks or inline aerosol. Details of HMEs include design set by International Organization for Standards. Performance depends on brand. Not enough heat or humidity causes issues. Placed near patient, not ventilator. Not for children or infants. Heated humidifiers improve water output. Are used when bypassing upper airway and during mechanical ventilation. Must have temperature monitored. Use a power source. Risk airway burns. 5 types of heating elements are: hot plate, which sets under, wrap around, which surround the chamber, yoke or collar, that is between reservoir and gas outlet, immersion, which is placed in the reservoir, wire, which is in the tubing. Reservoirs used are large water reservoirs or have a gravity feed system to minimize refilling, because heated humidifiers can evaporate more than 1 liter of water per day. Humidity levels for intubated patients should be at least 30 mg per liter. Heating is used to keep airway temperature near 35 to 37 degrees Celsius. If humidifiers run under 32 degrees Celsius, humidity may drop and cause increased airway plugging. Devices used for aerosol therapy are aerosol mask, face tent, T-tubes, tracheostomy mask. All of the devices use bore tubing to minimize flow resistance and prevent occlusion by condensation. Enclosures are used for aerosol treatment on infants and children. Issues with enclosures are heat retention and CO2 buildup. This is resolved by high flows of gas to wash out CO2 and heat buildup. 6 main issues with aerosol therapy include cross-contamination and infection, environmental exposure, inadequate mist, overhydration, bronchospasm, noise. Ways to avoid cross-contamination and infection are by adhering to guidelines and replace water frequently. Ways to limit environmental exposure are by following CDC standards. These issues are common with tuberculosis patients. Way to avoid inadequate mist production is by checking that the device is set up properly. Overhydration can be avoided by closely monitoring patient and check for swelling pulmonary secretions after therapy. Bronchospasms may occur, in which case you should stop the treatment immediately. End of study guide.